Hello, my name is John. I'm here with Cancer Stories to tell you about my experience with oesophageal cancer. I don't know whether you're aware or not, but there are 8,000 cases per year of esophageal cancer diagnosed in this country. Roughly, there are twice as many men as women. If you wanted to know more, then watch my video. Hello, my name's John. I'm 72 years of age, although I prefer 35. I'm married, my wife, Betty, and I have 3 sons and 5 grandchildren. I live locally, Colville, or as my boys call it, Colville, and I'm originally from Anstey, and my wife is originally from Dewsbury in Yorkshire. We happened to meet many years ago when I trained as a textile technician at the Bradford Institute of Technology, which is now the university. And on completion of my course, we moved back to Leicester, where my wife became a district midwife, and I carried on in the textiles. The textiles, however, started to go down the drain, and with the advent of several redundancies, I then moved into, by accident, into finance, banking and insurance. I did that for nearly 25 years and took early retirement 14 years ago. Anyway, getting on to the cancer. So all I can say is you've got it, I've had it, thousands of other people have got it too, and many more thousands of people have got over it, which is what I hope you will do. And what you've got to do is to be positive, you've got to accept you've got it, and just get on with it. I know it might sound flippant, and it certainly isn't easy, but the support that I had from the girls at the Oswald building and the Leicester Royal, and the support of my wife, that is most important, that you'd get the support of your family too. But just remember, they also need your support, because not only is it a shock for you, when they say you've got cancer, it's also a shock for them. Now, I was lucky in as much that my wife is a qualified nurse and midwife, although obviously retired. She'd never nursed cancer patients before, and I was a little worried in case she started to apply the midwifery techniques to me, but that was okay. But you remember, they have got to go through it, and they've never come into contact with it, so they will also get the support of the girls should you ask for it, and should they ask for it too. I know I did, and my wife did as well.
John, thanks for coming in today. I appreciate you spending this time with us on the video diary programme. You are suffering from an esophageal cancer?
It was, yeah.
I'm sure the viewers would like to know how that came about. You know, how were you diagnosed initially?
Yeah. Well, it's funny. I thought an ear infection, but I also had a touch of indigestion. Now, I don't suffer and never have suffered with indigestion, but I went to see my GP and he gave me some ear drops and said he couldn't see anything in my ear, and I went home with my ear drops. My wife said, "Did you mention your indigestion?" I said, "No, I never thought about it." So she sent me back. And I just mentioned to the doctor, I've got this indigestion, but I never suffer from indigestion. And he said, "Okay, then we'll get you in for an endoscopy." And I had to go to one of the local small hospitals. And that was in a matter of about 3 days. It was quick as that. There was no messing about. I was in and that was it. And I saw the doctor, my GP, approximately 7 days after that. And in which case then he said, well, you know, it was cancer. Well, so they thought. I mean, they were waiting for biopsies, and I had biopsies, etc., etc. And cancer was diagnosed. And I was then sent to see the surgeon, David Bowery, at the Leicester Royal, and he explained everything. I had to have particularly aggressive chemo to start with because they were wondering whether they could actually operate or not, because it was quite big. I knew something must have been there because, funnily enough, after a while I could actually feel it. And anyway, with the chemo, it certainly shrunk the tumour and they were able to operate. But getting on to the chemo, without a doubt, as it was aggressive, that was absolutely horrendous. I was really ill with it. Vomiting, I couldn't stand up, I didn't know where the devil I was. I was really ill. At the cancer support meeting which we have, we were talking about this, and the actual surgery I had, not wishing to be flippant or take it lightly, but the surgery was nothing compared to the chemo. I didn't lose my hair though, funnily enough. Lots of us in the chemo suite got shiny pates, but I managed to hang on to mine. I did lose a lot, but I still hung on to it.
Do you remember the type of chemotherapy or the duration?
No, I can't remember what type it was. A bit too technical for me, was that. But,
what about the number of sessions and weeks?
I had the first session, I think, was about 3 or 4. I can't remember whether I went once a week. I know it was one session, and I was there virtually all day. And if you go then you have it, for goodness sake, avoid the sandwiches in the tray. They're horrible. Soup's not bad. But yeah, I had the 4 sessions, and then I managed to get home, and then it sort of hits you when you get home. But I just sort of got in the armchair, watched TV, that's about all I could do.
Is there any tip to know how to get through that difficult period?
Well, unfortunately, I think it's just something that you've got to put up with, because the end result is important and you want the best end result. So unfortunately, we had to put up with the chemo. I actually got at one stage where the district nurse was coming around every few hours to give me a jab of something to stop me vomiting or puking.
I see.
But then after a while that wore off. But I still felt ill with the chemo.
After you stopped the chemotherapy, how long until you felt back to yourself, in a way, after the chemotherapy went out of your system?
Guessing now, it's quite a time, but I would think possibly about a week, 10 days, something like that.
And what was the next step, treatment-wise?
Next step, I was due into the Royal for the op. Oh, crikey, I've forgotten, I had scans too.
Yeah,
I had the scans at the Leicester Royal. Then I had to go up to Glenfield. They got a mobile one there, and I had to have it there. They inject you with the radioactive dye, whatever it is. And then I saw the surgeon. He had a look at it, and we discussed it and took it from there.
What did they tell you about the extent of the disease that was there at the time?
Oh, it was a big one. It was very close to the aorta, and that's why they wondered whether or not they could actually operate.
Yes, that's the major blood vessel, the artery that is taking blood.
Yeah, I've just had an aortic scan actually. Yeah, because unfortunately I lost 2 people, friends, with ruptured aortic aneurysm. So any men over 60, if you haven't had one, go and get one.
Yes, that's another area, isn't it? The aortic aneurysm.
Yeah, it is. But after the scan, as I say, I saw David Bowery. He explained everything to me very well. And I've got no option, you know. You either have it or you don't. And if you don't, well, there's only one outcome. So I had it.
What did they say? You know, how successful was the procedure?
Well, it seems to be very successful.
Indeed.
Yeah, I'm still here, aren't I? But Yeah, I lost most of my stomach
Yes.
and quite a bit of my esophagus.
Did it actually involve the stomach, the tumour in your case?
Yes, part of it, yeah.
It did.
The part of the stomach I have left is now here in my chest.
I see.
And when I drink anything, I can hear it going. You know? But yeah, the result of that too is I don't eat as much. I still eat everything virtually, no holds barred. But obviously I haven't got the capacity to eat as much.
Yeah.
So I eat smaller meals, but I eat more often.
Was that advisory, or did you come across that?
Oh, it was
pattern yourself?
advised, but to be honest as well, I would have done it anyway, because if you try to eat a normal sized meal,
Yeah.
it hurts. And obviously my stomach, what I've got left, has stretched now.
Yeah.
So I do eat more than I did initially.
Okay.
But it's still a smaller meal than whatever I used to eat. Good thing really, because I lost quite a bit of weight and I was getting a bit too heavy. So
Okay.
yeah, I did okay.
So tell us about the operation itself.
Well, that was quite quick after the diagnosis. The actual operation, they say, is quite complicated and quite a long procedure. I had my thyroid removed, so I don't have a thyroid anymore, so I take thyroxine for that. And apparently, well, I was cut from the base of my sternum down to the navel, and apparently some of it comes out through my throat. It was quite a long job, so they say, and well, obviously I don't remember much about it.
No. Did you go to ITU afterwards for recovery?
Oh yes, I did. Yes, I had about 3 days in ICU, and I can't remember that either.
Really?
My wife said that whilst I was unconscious, they would let me come towards the surface, so to speak, of consciousness to see how I was reacting to the pain.
Yeah.
Again, I don't remember anything like that. All I remember is sort of coming round and going back onto the ward.
What do you remember about your recovery process on the ward?
Well, the actual recovery from the intensive care, I remember nothing other than coming to and going back to the ward.
But the next few weeks?
Yeah, I was in about 10 days, I think, 7 to 10 days. Again, it was quite uneventful as far as I'm concerned. Now, I felt ill with the chemo, but with the surgery, I didn't feel ill. I was very, very tired. I was sort of exhausted. But nowadays, they tend to get you out of bed as soon as they can and get you mobile.
Definitely.
And I wasn't exactly doing a sprint, but I was walking around quite gently about 3 days after I got back to the ward.
Yeah.
You've got to be careful because I was tubed up left, right and centre. I think I had about 7 tubes altogether, something like that. So you can't really walk far anyway. But from there, towards the end of the 7 to 10 days, then gradually the tubes were taken out and I just went home with a feeding tube, which was there in case I couldn't swallow anything and couldn't eat anything, in which case I would have fed myself through this tube. But fortunately I didn't have to.
Okay.
I just had to irrigate it every day to make sure it was clear with distilled water, just in case I did have to use it. But as I say, I didn't. I just had normal meals.
Let's talk about how things proceeded when you returned home after the operation, after that 10 days or so. How did you find your recovery went after that?
Well, it was, I suppose, uneventful. My wife did everything for me that I couldn't do. I found that the slightest exertion made me feel exhausted. That's the only downside to the surgery that I felt, actually. When I got home, I had a shower, and it took me all my time to do it, and also all my time to get out of the shower. But once I got downstairs, I could sit down and watch TV. I was all right whilst I wasn't exerting myself. But as regards everything else, I could manage to take myself to the loo. Well, one thing I couldn't do, with the chemo, it affects the fingertips. And I couldn't fasten little buttons. Oops, sorry about that. Couldn't fasten little buttons. Also, if I touched anything cold, it felt as though it was actually burning.
Yes.
And if I went outside and it was raining, and the rain went onto my face, it felt as though the water or the rain was scalding water.
Really?
You know.
Onto your face?
Yeah,
so
onto
it was
my face.
more than just your fingertips.
Well, I've got my hands in my pockets always, so I didn't feel it. But my fingertips, yeah, touching anything.
Yeah.
You know, it affected that. And I think even now it's affected my toes. Because my big toe and little toes are all right, but the ones in the middle feel cold all the time. Although when I touch them, they're not. You know.
What did you notice about your appetite and eating patterns?
Well, my appetite was normal. I've got a normal appetite. I obviously can't eat as much as I used to. As I said before, it's smaller meals but more frequently. The only thing I have difficulty with as regards eating is the swallowing of the ordinary white bread. I don't eat white bread very often anyway. Wholemeal bread is not so bad. Granary bread is a doddle, and these ciabatta, is it? Little loaves from Morrison's, get a plug in there. They're easy to swallow. It's a very light bread. I just have one of those a day, and that's as much as I want. Sometimes I might have cream crackers. But I eat normal meals, quite normal.
Yeah.
You've got to be careful when you swallow initially to start with, because obviously the esophagus is narrower. And you lose, so the surgeon told me, you lose a sphincter muscle which stops the food or the acid in your stomach coming back. Now, when you're sitting up, such as I am now, it's quite okay. When I go to bed, if I've had something to eat later on, or if we've been out sometimes and we eat later than, say, our normal time for dinner is around about 5:30, 6 o'clock, if I eat much later than that, say about 9, then I'm in trouble when I go to bed, because it comes back.
Yeah.
Occasionally I've had to go get up and go downstairs and sleep in the armchair when I'm sitting up. Otherwise, it's bad. But I've only had that a couple of times, you know.
Do you ever have that syndrome called dumping syndrome, where the food goes through the bowel too quickly?
Yeah, not much. 6 times.
Really?
As I said to Heather, twice in Aldi, once in Morrison's, twice in Bradgate Park, and once on the battlefield at Bosworth.
Really?
You don't really know it's coming, so you've got to be careful. Normally, my bowel movements are quite normal, but occasionally, bang, I've got it. And you've got to be quick.
You basically have to go to the toilet straight away.
Quick. Yeah, without a doubt. Aldi, they haven't got a loo, so I just made it twice in time to McDonald's next door. You know, Morrison's I just got in time there. The battleground, that was the same, just in time. And Bradgate Park, when there was no bracken about as well, but I didn't make it to the toilet.
Okay.
But, yeah, I mean, we'll laugh about it, and you've got to laugh about it because you can't do anything else. But yeah, you've got to be careful with that. You know,
I'm interested in that sense of coping, how you cope with these awkward symptoms and complications. What do you think is the way to manage, you know, things that are unexpected and uncalled for? How do you carry on as normal the best you can?
Well, I just don't let them bother me. You can't do anything about it. You know, so why worry? You know,
you try not to dwell on it, is it?
Oh yeah. You know, as regards to dumping syndrome, it's a big joke. I know it's not very funny, but
you can see the lighter side of it, if you like.
Yes, you must do.
Yeah.
You know, if you sit there worrying about things, you're ruining your entire life doing that. You can't do that.
No.
You know, it's not fun, obviously, but you know, as I say, just get on with it.
Did you ever have a period where it really got you down, or you were really anxious about?
No, I didn't let it.
Your physical health condition?
I wouldn't let it. You know, I know it's there. If the worst had come to the worst and they told me, I accept it. You've got to. I mean, we're all going to go, but you're
talking there about that very
the ultimate
question about
Yeah.
if I wasn't around in the
Yeah.
future. For you, you can face that, can you?
I've got to.
Not everybody can even think on
No, possibly
along those
people
lines.
can't, but you know, I'm lucky, I suppose, really, in as much that I've always tended to be sort of positive. It does help. It also helps if your family or spouse, carer, and children, etc., are as positive. Because if they're positive, it helps you.
Yeah.
And if you're positive, it certainly helps them, because it's got to be mutual, the assistance between you and your family,
Yeah.
and your family and you.
I agree. You mentioned there that having the family around is very important.
Oh yeah.
What was your observation of what role they had, and also what communication you had over all these issues?
Well, of course, they were fully informed of the situation. They knew what it was. They would come and visit me when I was in the hospital. But again, they never hid any sort of, let's say, feelings from me. They were worried, obviously, but they didn't let it get them down. And also, as they were positive, it didn't get me down. And, you know, same with my wife. And I know my wife worries. She does. You know, she says at times she doesn't, but she does. But again, the support I had from her, you know, she wouldn't let it get her down, and therefore it didn't get me down. Yeah. We knew what was going on, you know, so we just accepted it.
Do you cope in similar ways, the two of you? You and your wife?
Oh, yeah. Yeah, we, you know, we've always shared everything. There's no... don't keep anything for anyone. My wife sometimes gets a bit broody. Well, I won't say broody, but moody sometimes. But I suppose that's a woman's prerogative. But no, as regards support and everything, we're very close.
Yeah.
Always have been.
How did she cope in general, from her point of view of seeing what you were going through?
Well, she knew what I was going through. There's no two ways about it. She did. But I think she knew that if I knew that she couldn't cope, it would affect me. So she coped. And I hope I helped her to cope just as much as she certainly helped me to cope.
Yes.
So it was a mutual thing. As I say, we don't keep anything from either one of us.
Were there any issues regarding communication, how you told people in the family, how you told family?
No, I just come straight out with it. That's, as I said to Heather earlier on, I mean, probably 10, 15 years ago, 20 years ago, cancer was a dirty word.
Yeah.
You never talked about it. Now people do. And I think it's a good thing, really, because it's there. And I think it's going to become more prevalent, because the older we get, the more likely we are to get it. I remember somebody, I think it was that guy that did The Naked Ape. I can't remember his name now. But I think he said once that cancer is a disease of civilization. Animals don't get it because they get to a certain age, slow down, and they're preyed upon. But the ones that are in captivity, and ourselves, we live longer and longer and longer, so therefore we're more likely to get it. And I think that's what happens here. There's an increase in cancer, but I know unfortunately children get it and younger people get it, but nowhere near to the extent as the older people do. And I think that's what's going to happen. I mean, the medical profession is doing all sorts of things to find vaccines for this, that and the other, and trying to make us live forever. But with a disease like cancer, we just got to get on with it and know that it's there, and it possibly still will always be there.
Do you see there ever being a cure for cancer?
Well, they're certainly working on it, and my wife and I donate to our charity, obviously, and we get let's say information sheets from them, and also we get bulletins on the net. I think there's certainly more people living with cancer now, or through cancer, let's say cured of cancer, if you can call it a cure, than ever there was.
That's quite right.
It's like prostate cancer, and the doctor said to me one day, he said, most men die with prostate cancer, but they don't die of it. And it's possibly that way it may happen with cancer, where they sort of stop it, but...
Well, that has happened. Around about a third of people don't die from their cancer diagnosis, but something else.
Years ago, they would have done.
Yes.
I mean, what I had 20 years ago, I wouldn't be here.
Yeah.
Pretty sure of that.
Have you seen these changes in attitudes in society through personal experience, or...?
No, I don't think so. Only what you see on the TV, in the newspapers, and on the news.
Yeah.
One or two people, well, they certainly talk about their medical condition now. I don't mean they harp on about it, but we're more open with people now, or with friends especially, and family. Well, we're just more open with it now. Any condition like that.
That's right. Have you had the chance to meet other patients who've been suffering similar conditions?
Yeah.
What's been your impression of that?
Oh, it's very good. I go to the cancer support meetings 4 times a year, and we're all there with the families or the carer or spouse, whatever it may be, and it's a big comfort to know that you're not on your own. And that is the thing.
Yeah.
It gives you a big lift. You're not suffering on your own. We describe symptoms. We've all basically got the same sort of symptoms with this, and we have a bit of a laugh about it, and we compare notes, so to speak. But it is a big help, just purely and simply being there with other people that are in the same boat that you're in.
So that large informal support group is certainly an advantage in terms of
without
how
a doubt.
you cope with your condition.
Without a doubt. Yeah. I'm not saying I wouldn't cope if I didn't go. I probably would. But it certainly makes it a lot easier.
Because not all areas of cancer, not all geographical areas have that.
No. So they say. I think it was David Bowery started the one off for us for the esophageal cancer. Oesophageal, whichever the way it is. And as I say, we're all there, and it works well. Works well. He'll answer questions. The girls answer questions too, as regards diet and sort of aftercare. Kathy, she would. Well, she was always been there if ever we've had a problem. Initially, when I got out of hospital to start with, the symptoms I had, it plays havoc with your blood sugar. And I would suddenly break out into a sweat, literally. I don't now, but I did then. And as I say, my wife hadn't nursed anyone with this before, but Kathy was just a phone call away.
Yeah.
If we didn't actually speak to her at the time, she would be back to us pretty quickly. And 9 times out of 10, she would say, "Oh yes, that's expected."
Yeah.
Well, not much fun, but at least it's normal, so to speak.
But then if you also hear that from another patient, that's even equally
we've all done
more
it. We've all
powerful.
done it. Yeah.
And you've got that chance now.
Yeah.
Okay, so let's come on to thinking about what resources were helpful for you. You've mentioned your family as being useful, and you've mentioned the support of the clinical nurse specialist team and the support groups. So they're all useful. Was there anything else that helped get you back to where you wanted to be?
To be honest, no. That was all the assistance I needed. Obviously, with the family, they're the first ones. They're there all the time, and I was lucky because all my family have been very supportive. So I've not really needed anything else.
No. How much encouragement did you personally need to start doing things again and push yourself a little bit? Was it something where you needed a little bit of extra motivation?
No, I don't think so. All I wanted to do was get out and about. I remember when I was in the hospital in the Oswald building, I said to one of the doctors, "When can I go home?" He said, "Why?" So I said, "Well, I've counted the bricks on the wall opposite, and I was that fed up, so I wanted to get out. But I just wanted to get away from it, so to speak."
Did they give you any specific advice when you went home?
Yes, they said the sort of things I was likely to experience. Yeah, they do tell you about that.
Yeah.
The dumping syndrome especially. Also eating and diet. Some people have to find that they can't eat certain foods after The funny thing is, that suddenly flashed through my mind. I used to like pork pies, and I still fancy a pork pie now, but I can't eat them.
Is it the constituency that's wrong?
Sorry?
The constituency that's wrong.
Yeah, I think it is. It's fatty.
Yeah.
You know, but I like pork.
Yeah.
You know, but they run through virtually everything that you're likely to come into contact with as regards your condition.
Okay, so you'd had the surgery and it seemed to be successful, and you were making, a good recovery.
Yeah.
Did anything untoward happen that worried you?
Well, it didn't worry me, but they told me that they'd found cells in my lymph nodes. So therefore, I was going to have another session of chemo, which wasn't as bad as the first lot. And it kept making me go to the loo. But apart from that, I felt a little bit sort of ill, I suppose, tired, but I wasn't sort of really down with it.
Yeah, you coped with that.
But I coped with it, yeah, quite easily, yeah.
Probably it was a different regime to the first.
It was, yeah.
And how many weeks did you have to have it for?
I think it was about 3 or 4.
And what was the result of that in terms of success?
Well, blood test, that was it. You know, away you go. And
it did put it into remission, had
That's right, yeah.
So it had done the job.
Yeah.
And did you feel quickly back to your normal self, or?
No, it took a little time. When you say normal, as I say, I didn't feel ill.
Yeah.
I sort of lacked energy.
Yes.
And it gradually built up. I would say it possibly took 6, 7, 8 months, something like that.
Yeah.
To get back where I could be gardening, cut the lawn or whatever.
Because you were retired at this stage anyway, weren't you? What were you doing work-wise? You mentioned about the...
I was in finance over in the West Midlands.
Yes. And how long ago had you retired at this point?
14 years.
Really?
So I'd say I could get out early, you see.
You were well into your retirement.
Oh, yeah.
And you had your routines going.
Well, yeah, I suppose I do now, yeah. A routine as such, yeah.
Did you get back all the things that you temporarily stopped after you had the surgery and everything else?
Well, I'd always done what I was doing before.
That's what I'm asking. Did you get back to those things that you were doing before?
Yeah.
What were they? Tell us about your hobbies and interests.
Well, again, it was mostly gardening, DIY, carpentry. And then, as I say, my wife, she had a mild heart attack, so then we were referred to the gym. Well, I wasn't as a cardiac referral, but she was, and I thought, well, sooner than sit there waiting for her, I'll do it, I'll join in.
That's very interesting that she was offered that programme as part of her rehabilitation.
Yeah.
I don't think you were in that sense.
I wasn't offered it, no.
No, not that kind of formal rehabilitation.
No.
But you did it anyway.
I did it, yeah. Well, otherwise I'd be sitting there waiting for her, you know, so... I just joined in. And
what was the effect?
I feel better than I did before. Well, say better. I not felt ill, but I feel fitter.
So it had a positive effect on you?
Oh yeah, without a doubt.
Now, I don't know if you're aware of this, but in the cancer domain, exercise and rehabilitation that we're talking about here are actually being more and more promoted because we realise the benefits that can accrue.
Oh yeah.
Would you advise it to others, given that you did it anyway because your wife was signed up to it, but it wasn't specifically prescribed for you?
No, it wasn't.
Would you say, in retrospect, this is something we should be doing as a routine now?
Certainly. I used to notice the difference after the winter when I start gardening in the spring.
Yeah.
You know, it took quite a bit of effort to get going, but now, with going to the gym and right through the winter, straight onto it.
But on the other side of the coin, obviously you're improving from a certain low level yourself. When would you say in time it would be safe to start going to the gym after you...
After the operation?
Yes.
Well, you're very, very weak. I would say possibly very gentle exercise, and I mean gentle exercise, possibly after about, say, 3 or 4 months. You know, what I do now is relatively vigorous.
Yeah.
But I certainly couldn't have done that.
No.
What I'm doing now.
You built up to that gradually.
Oh yeah. But as I say, I was never done it before. Well, I used to hate it at school, but now I pay, don't I? I certainly go to the gym. But yeah, it's certainly beneficial.
How's your wife getting on with her rehabilitation?
Fine. Yeah, fine.
Did it have a similar beneficial effect for her?
Yeah, she does. She's more keen on it than I am, to be honest. You know?
Is she?
Yeah.
So you both can kind of help motivate each other in a way.
Oh, it is. Yeah. Well, that's what I've said. You see, I've got a positive family.
Yeah.
A positive wife.
Who else is in the family who you've told about the cancer and are quite involved? Your children, I think.
All of them. Yeah.
And what's
sons, daughters-in-law, grandchildren.
How would you summarise their reaction to seeing you go through this really difficult time?
Well, they didn't show any reaction. They were positive about it. Now, obviously, they would have done amongst themselves. But to me, no, they didn't show anything. They knew and they accepted it and they treated it, I wouldn't say they weren't frivolous about it, but they sort of didn't let it show, or that it didn't worry them, if you can get my meaning.
Yeah.
They accepted it, they talked about it. One of my granddaughters, she didn't like it when she saw all the tubes in me, you know, but apart from that, no, they all accepted it, and you know, they were all positive about it.
Is it partly because they saw you were doing well, or were they just genuinely positive themselves? That was their style?
They are that way. Yeah, they are that way.
Come up to date for us then. After this top-up chemotherapy, it was all clear. You were getting back into the normal swing of things. Were there any areas that were still slightly a concern, or any areas that you felt they're not quite back to 100%? Or do you feel really back to your normal self now?
I don't know, yeah. I can't think that after I started to get better, or let's say, when I say better, because I wasn't ill, but after I started to get my energy back,
yes,
I didn't feel ill at all, and it just gradually increases. I would say probably at least 12 months, maybe 18 months, you know, for some people. It depends on, well, people are different, aren't they? You know, I would say 12, 18 months and I was fully back to normal.
Really? Yeah. So in terms of your energy, sleeping, appetite, concentration, you know, those kind of areas, they're all pretty much back to normal?
Yeah.
So that's interesting, because it tells me that people even going through this major surgery and the two sessions, if you like, two sections, I should say, of chemotherapy, people can still get back to really their normal selves.
Oh, yeah.
There's no reason to not aim for being back to normal.
That's right, yeah.
And that's actually an encouragement for patients, you know, who'd be watching this and thinking, well, I've got this to face yet. Where am I likely to end up? You're likely to end up in a good place.
I would say, apart from the reflux, you get that, and the dumping. I'll be back to normal. I always have an fish oil capsule every day. I take the thyroxine every day.
Yeah.
I take the I forget what they call it, well, whatever it is for the reflux.
Lansoprazole.
Yeah, I take that twice a day. But that's about all, you know, that I do. People, I was trying to think of what they've got to be careful of. You must remember to take that stuff. You know, because, you know, and also blood sugar, as I mentioned to Heather.
Yes.
I forgot about that one. The operation does play havoc with your blood sugar. Well, it did me, and it still does.
Yeah.
Sometimes I get an urge for sweetness, for sugar. I don't take it in tea, but on odd occasions I've sat down and I've eaten an entire packet of biscuits. Other times I've had probably a couple of teaspoons full of runny honey, and I can, or a Mars bar, or chocolate, anything like that.
Yeah.
And I can literally feel my blood sugar whoop, as quick as that. you know.
Is there any explanation for this unstable blood sugar now?
Well, they think it was the operation. You know, as I say, they cut through the nerves and such like, and maybe it's that. And also with having a, let's say, smaller stomach, maybe the food's passing through me quicker. So therefore I don't get the full nourishment from the food.
Yes, I see.
I was quite surprised when they said, as regards my diet, full fat milk, don't like it, but always have the skimmed, butter, anything like that, cheese, you know. So I eat that.
Well, what about those? Those high calorie
They
things?
told me to, yeah, high calorie.
They told you to eat
They
those
told me to eat
because-
that, yeah.
Because it would keep your weight stable and you
Well, possibly, yes, because obviously, I mean, I'm losing weight now. I want to lose weight because I wanted to get down to my fighting weight, which is about 14 stones. And in the last year, I've lost 7 pounds.
Yeah.
But I think that's with my diet and the exercise.
Yes.
You know,
you're
what
heading in the
they
right-
weigh me every time I go in. They say purely and simply what they're looking out for is not steady weight loss, but rapid weight loss, which I don't get. Might have been steady.
They're watching out for that as a concern.
Yeah. I get a blood test as well every time I go.
Okay.
That's always been okay.
What plans are you making for the future now?
Well, just to live life to the full. Simple.
Yeah.
You know, at my time of life now, there's not a lot more I want. Christmas coming up, it drives my wife mad sometimes because she'll say, "What do you want?" And I can't think of anything. Although I've already got my Christmas present, she bought it last week. But, no, we've got everything we want. We've got each other, we've got the family. We get a lot of fun out of the grandchildren. But no, just live life for the full, enjoy myself.
Are you able to do that to your satisfaction?
Yeah.
Do you think that having been through this cancer, that you changed as a person, the way you look at life?
Oh yeah. You realise, you know, you're only here once. So whatever you want to do something, do your best to do it. Now, I've not been particularly, say, ambitious as regards, say, what these bucket lists that they make.
Yes.
You know. But yeah, I want to go Australia, New Zealand. We've been touring all over the place around the world. That was it, you know. And as I say, in regards to everything else, we've got everything that we want, you know.
What do you see in the future? Do you look ahead or do you just take each day at a time?
Well, I do look ahead, yeah. I think what we're going to do in the future, but there's not a lot more that we want to do. I mean, I don't know, maybe when we get to a certain age we might downsize, but that's about all, you know. As regards everything else, no, on a day-to-day basis, to a degree, yes, I do live like that, but I don't just not narrow sort of vision. You've got to look at, open it up, you know, look around.
Thinking about your whole experience of cancer now, everything that's happened to you, what would you say to a new person who's coming into this for the first time, you know, who's not sure what to anticipate in the future?
Yeah, well, for me now, it's easy for me to say this, but as I said before at the beginning of this interview, just realise you're not on your own. There's people there to help you and to help your family. And, you know, it's not going to be much fun, but you will get over it. You know, one way or another, you will get over it. So, you know, make the most of it. It's an experience I wouldn't wish on anybody, but it's an experience that to a certain extent, it's made me a bit more mature, I suppose. Made me a bit more appreciative. Purely and simply because if the worst had come to the worst, I wouldn't be here. You know, so I just get on with it, and that's it. And as I say, for you, yeah, you get on with it. You'll be okay.
That's great. Well, I appreciate you coming in today
Not
and spending this time with us, and I'm sure the viewers want me to thank you for that insight you've given into your condition and how to cope with it. It's been very valuable, and also you've given a lot of tips along the way about how to manage, and you've coped with a lot, you know, the major operation, recovering at home, the chemotherapy both before and after, but the fact that you've come back to pretty much your normal self with a few little areas which you know, you're still managing, that's still the most important thing, is that you have done well. That is an inspiration for everyone. So thanks for coming in.
Not at all.
And all the best for the future.
Thanks very much.